Last one, so I'll be short, even because I have only 4 minutes, so I have to be short anyway. Thanks for the invitation from Aline and Bayer and the great opportunity. What I'm going to give you today is a brief flavor of our company, which is called ZeClinics, and I am one of the co-founder and CEO of the company. So we created this company 2 years ago as a possible solution for a major problem in the pharmaceutical industry. And this was the fact that in the last 20 years, there was a huge increase in the investment in R&D, not corresponded with an increase in the approval of new drugs. So this resulted in a very high cost for every new medicine and a process that takes about 15 years to go to the market. Our solution is to use zebrafish, a little fish, in early preclinical phases in between cell and rodent studies in order to narrow down and select the best candidate drugs to bring forward into the project. The reason for that is because zebrafish has been studied and validated by 20 years of academic research. It is a highly predictive model for drug effect in humans, and although they swim in the water differentially to us, they share a high level of homology both in the genome and in the biological process as compared to humans. However, as compared to classical rodent models, they are 10 times faster and cheaper, and they can be used in high-throughput phenotypical screening. So with this model, we develop a large series of safety and efficacy assays, but today I'm going to give you just a snapshot of one of our gold service, which is the cardiovascular toxicity assays. Basically, we use fluorescent zebrafish light, measuring a couple of millimeters, and expressing GFP protein in the heart and RFP protein in the blood. And by combining advanced imaging technology together with our property software of analysis, we're able to measure all a series of cardiac and vascular parameters in a very quick and cheap manner. And a similar assay in rodents, it's 10 times much more expensive and slower, but it's also less informative because in rodents, only applying telemetric tools, you can measure very basic parameters in the cardiovascular system. So here I'm showing you an example of what our software ZCardio does by measuring the activity of the heart of a zebrafish, in which you see on the left a normal negative control animals having a normal beating activity over time in the ventricle and atrium, while on the right you see an animal treated with haloperidol, a cardiotoxic compound, which causes a bradycardic effect, less beats, but also a very typical phenotype of arrhythmia called bigemic, basically 2 beats in the ventricle every atrium beat. In this other example, you can see how the software is analyzing the blood flow velocity in the main artery of the animal, in which you see on the left a negative control animal, where we can measure and quantify the velocity in the maximum and minimum phases corresponding to the maximum and minimum blood pressure, while this is an animal treated with propranolol, another cardiotoxic compound, which shows a reduction in the velocity of the blood flow in the artery. So basically with this tool and combining biology and some technology, we are able to generate advanced parameters that are very useful for the drug discovery and the selection of the best non-cardiotoxic compounds. I hope with this little presentation I gave you a bit of idea of the power of zebrafish and what we can do with that at ZeClinics. Thank you for your attention.